Good morning, students. Today we will learn about the cataract. So, what is the meaning of the cataract? Definition: a cataract is a lens opacity or cloudiness. So, there is a cloudiness appear into the human eye is known as a cataract. So, our lens opacity will be decreased, and due to the opacity decrease, cloudiness appear into the human eye is known as a cataract. So, cataracts can develop in one or both eye and at any age. So, in human eye, there is a formation of cloudiness due to the decreasement of the lens opacity. So it occurs into the cataract formation. So it develops into any age and occurs into one or both eye of the human. Okay. So this is the mainly introductory portion and definition of the cataract. Next, that is the risk factor. So what are the risk factor affecting to the cataract? So first of all, that is the cigarette and smoking, which mainly affect your human eye. So due to the cigarette and smoking, cataract may be affected. Then long-term use of the corticosteroid, especially at high doses. We all know that the corticosteroids tablets having many kind of the side effects. So due to the long-term use of the corticosteroid may affect into the human eye and it will lead to the cataract. Okay, then sunlight and ionizing radiation. Our eye is very sensible organ. So due to that ionizing radiation and sunlight, it may affect to the opacity of the lens and it will lead to the cataract. Next, that is the diabetes and obesity. So due to the diabetes and obesity, human having a problem into the eye opacity of the lens. Then eye injuries can increase the risk of the cataract. So these all are factors which highly responsible for the cataract, and these factors having a high chances of the cataract. Okay, so this is all risk factor. Next, that is the types of cataract. So what are the types of cataract? Three most common type of the senile cataract are defined by the location in the lens, then nuclear, cortical and posterior subcapsular. Okay, so there are mainly three types, but in that, first of all, that is a senile means age related cataract, which defined by the location of the lens. Okay, so due to the location of the lens means nuclear, cortical and posterior side subcapsular. These all are the location of the lens. So which is known as a senile cataract or age-related cataract. Next, there is a visual impairment depend on the size, density and location in the lens. In our eye lens, there is a size and shape and proper density are localized into our body. Then more than one type can be present in one eye. So there are some types which responsible for the human eye and can cause the cataract. Then clinical manifestation means what kind of the signs and symptoms occurs into the cataract. First of all, it may be painless or blurry vision. So human having a problem into the vision. So it can't proper visible. So blurry vision and painless. Next, that is a perception that surrounding are dimmer as if glasses need the cleaning. Means if a picture is well defined and well clear, but due to the cloudiness in the human eye or blur vision, they can't see properly. So the surrounding atmosphere are perception as a dimmer or light. Then light scattering means reduce the contrast sensitivity and sensitivity to glare and reduce the visual acuity. Okay, so there is a reduce in the contrast and glare means vision. So due to that the light scattering occur. So other effect include the myopic shifting means return of the ability to close work like reading fine print without eyeglasses. So without the use of the eyeglasses reading is not proper. Then astigmatism means monocular diplopia means double vision. Okay, then color shifting means aging lens become the progressive. Okay, so these all are due to the some signs and symptoms related to the cataract. So color shifting and more observed at the blue of the bruisens, then reduced light transmission. So these all are the causes and symptoms may be find into the cataract patient. Next, that is which kind of the diagnostic evaluation or study we can find out the patient having the cataract. So there is a some test performed for the diagnosis of the cataract. First of all, that is the Snellen chart. Okay, that it is useful for the visual acuity test. Okay, that is Snellen visual acuity test. Next, that is a degree of visual acuity is directly proportionate to the density of the cataract. Means for the density of the cataract, there is a degree of visual acuity is maintained. So both are in proportionate than human having not cataract. But if in proportionate, degree of visual acuity and density of cataract will be cause the cataract. Then ophthalmoscopy, slit lamp, biomicroscopic examination. In this, from all this study, we can find out person having a cataract or not. Okay, so these all are the diagnostic studies. Next, that is a management. So in the cataract, there is a three kind of the manage we can manage the patient. First of all, that is a medical management. Second one, that is a nursing, and last one, that is surgical management. So what include into the medical management? No, non-surgical means only medication and eye drops, eyeglasses treatment cures cataract or prevent the age-related cataract. Means without surgery, cataract can't be cured. So by the medication or eye drops, we can treat it, but we can further to prevent. Okay, then studies have founding that no benefit from the antioxidant supplementation, vitamin C and E, then beta carotene and selenium. So we can provide as a medical treatment, that is an antioxidant, vitamin C and E, and beta carbonate and selenium, but that is not highly treatable or highly beneficial to the patient, but this is just for a precaution. Then glasses or contact lens, bifocal or magnifying lenses may improve the vision. So human or patient can improve their vision by the wearing of the proper glass and lenses. Okay, then mydriatics can be used short term, but glare is increased. Okay, so this is included into the medical management. Next, that is the surgical management. In surgical management, in general, if reduced vision from cataract doesn't interfere with normal activity, or surgery may not be needed. Means if patient having not a highly risk for the cataract or not that much developed cataract, so no need to surgery. But if having a more problem due to the cataract, then surgery must be needed. So in deciding when cataract surgery is performed, the patient's functional and visual status should be primary consideration. So doctor and patient having the consideration for the surgery of the cataract. Okay, so for consideration and confirmation from patient and family as well as doctor, both are needed into the surgical management. So surgical option include the phacoemulsification, means method of extra capsular cataract surgery. Okay, so extra focal cataract surgery is done, and second one, that is a lens replacement. So the lens which having a decreased opacity, we can replace it. So second surgery, that is a lens replacement. Next, that is a cataract are removed under local anesthesia on an outpatient basis. So if patient having a need of the surgery, then we can prevent it by the providing the local anesthesia. Then when both eyes having the cataract, one eye treated first with at least several weeks and preferably months separating the two procedures. So if person having a cataract in both eye, then we can't surgery of the both eye at one time. After one several weeks or month, we can separate both surgery, two procedure. Okay. So this is the surgical management. In figure, you can find out the lens replacement during the surgical management. Okay. Next class, that is the nursing management. So in nursing management, withhold any anticoagulants the patient is receiving if medically appropriate. So if patient appropriate, then we can giving the proper medication and anticoagulant. But in some cases, anticoagulant therapy may be continued. So if patient convenient and benefit for the giving anticoagulant, then we can provide that therapy. Or else administer dilating drops every 10 minutes for 4 doses at least 1 hour before the surgery. So if person want that cataract surgery, then only we priorly providing the drops every 10 minutes before the surgery, at least for the 4 doses. Okay. And also antibiotic, corticosteroid, anti-inflammatory, all drops may be administered prophylactic, prevent the post-operative infection and also inflammation. So for the prevention of the post-operative infection and inflammation, we administer that anti-inflammatory, corticosteroid and antibiotic drops. Okay. Then provide patient verbal and written consent and instruction how to protect that eye and administer medication, recognize signs of complication and obtain the emergency care also. So we have to guide and counseling of the patient how to cure and how to prevent the complication of the eye and protect of that human eye. Okay. Then explain that there should be minimal discomfort after the surgery and instruct the patient to take a mild analgesic agent such as acetaminophen as needed. So we already provide the patient regarding the protection and care of the proper eye, but we also provide knowledge to the patient for after surgery there is some discomfort. Okay. And for the prevention of that discomfort, we can provide the analgesic agent such as acetaminophen as needed. Then antibiotic, anti-inflammatory and corticosteroid eye drops or ointment are prescribed by the doctor. So we can suggest for proper use and care of the eye, that is provide antibiotic, anti-inflammatory and ointment for the care of the eye. So, thank you.